first day back at work after a long weekend, the first long weekend of summer, and the first weekend after loosening some of the regulations about keeping that coronavirus at bay. People still nervous, and that probably includes Dr. Janet DeMille, the Medical Officer of Health for the Thunder Bay District Health Unit. She joins us now for our weekly update. Dr. DeMille, good morning.
Good morning, Lisa. How are you?
So I'm good, thanks. Now, we seem to have had a good week in terms of not many people testing positive. What's going on?
Yes, actually, I think we've had our best week yet. We're now at 79 cases. We announced the 79th, I think it was on Thursday or Friday. But I think when we last talked last week, we were at 78, so or very close to that. So really just maybe one new case over the last week. So it does show like we were on that trend of where it was we were seeing less and less numbers each week. So it certainly looks good. So knock on wood that it will keep that way.
Yeah, and how much more testing is going on?
So we've been, our testing rate is actually very good. We've certainly up here in the north, and for us in particular, we're above the provincial average, and we've been consistently that way over the last number of weeks. We do know that people coming forward for testing, the number is dropping. So in terms of assessment centers are less busy at the present time, but we're doing focused testings. We've done focused testing with long-term care homes and are looking at more focused testing in different areas as well, just because things are opening up, and it will be very important to monitor how things are going forward. We will be just continuing to encourage people to get testing if they have any symptoms, even a mild symptom. There's opportunity to get tested, and in fact, we would recommend to get tested not only for those individuals just to check, if they have COVID or not, but also, it does help us monitor what's happening in our area.
Yeah, and that's so important. So if I was feeling kind of crappy today, where would I go?
Well, so first of all, and I know you work at home, so that's important. I mean, certainly if you weren't feeling very good, or even just sort of one symptom, or weren't your normal self, we would certainly recommend just staying at home, right? Because we do know this is a very tricky virus, and we've seen it in some of the individuals who have been diagnosed with COVID that they've had very mild symptoms, just a runny nose or sinus congestion even, or just a headache that's a bit unusual for them, even one symptom. So certainly stay at home. And you can phone us. So we have a call center that's running. What we'll do is we'll talk to you, ask you a few questions, and if you meet the criteria for testing, which as I said are very low, we can arrange for you to have testing. So it's either, if you're in Thunder Bay, for example, we can refer to the assessment center at the Thunder Bay Regional Health Sciences Center. We also work closely with community paramedicine programs from Superior North EMS, and so we could actually send somebody to your home. And and then we can get that test, and if the results are mostly coming back within a couple of days, but if you haven't been exposed to somebody with COVID and you get the test and it's negative, then once your symptoms are over, you could just resume your sort of normal activities. And you're certainly able, you can, when you're at home, you can continue to work, of course, even if you have symptoms. So, so just any symptom will qualify somebody to being able to get tested. So,
you want to make, as you said, cast the net wide.
Yeah, and absolutely. So we do want to monitor. I think certainly right now most of the tests are coming back negative, which is very reassuring. But as you've indicated, things are starting to open up. So we saw things opening up on last week, and then over the weekend there was sort of more things. And today, I think it was midnight, 12:01 last night. A few additional things, for example, retail stores that have street entrance. We'll be able to open and of course, if they're ready, and of course abide by all the precautions. So as we see this reopening, it is important to continue that testing. Also, to continue all of those measures, right, that we repeatedly talk about. So, and I mean, I just indicated if you're not feeling well, just stay home and call us to get tested. But certainly, when you're out, maintaining that appropriate distance from other people, that's 2 meters. And if you're in like a retail store, for example, or if you're inside somewhere where it can be a little bit more difficult to maintain that physical distancing of 2 meters, then really wear a mask if you have one. And in fact, I would encourage people to have a mask with them, even a cloth mask, something that they could put on if they're going someplace where physical distancing might not be easy to maintain, right? I mean, I would certainly still encourage people to, as much as possible, even with a mask on, to maintain that 2 meter distance. But if you happen to be in a store and maybe the line, it's maybe a little bit more crowded, or it's a little bit harder to be at that distance from people, then wear a mask and make sure that it's a mask that fits properly and that it's on your face properly and that you're not touching it. And certainly those other measures, washing your hands frequently, and especially when you're going into or out of a store, if you do have a cough or a sneeze, make sure you do that in your sleeve. Watch about high touch surfaces. So if you're touching a lot of door handles or your cell phone, making sure that those are clean and disinfected.
Sorry, is it heightened awareness for you and your crew this week?
Yes, absolutely. It is, I think, an important time. I think it's, we were under some very strict restrictions in our activities over the last couple of months, and that can be very challenging, I mean, for us personally, but also for our economy. So I think it is important to be opening up. At the same time, we know that this virus is here, and we know that if people are too close to one another, that we could see increasing spread of the virus and more cases. And if we could get to a point where we could see another surge or a more rapidly increasing cases. So I'm cautiously optimistic, and at the same time, it is a bit nervous. Feeling about this is it's uncertain. I really do believe, though, that we can be successful in this. We've done well up to now. Our rates have always been fairly low, and we're lower than the rest of the province. We're doing well now, and I think it's those individual measures that we all take as individuals, as families, but also the places that are opening up. The retail stores, for example, workplaces where people might be returning. It's just important to really consider those measures and implement those measures and get used to those measures and making them essentially the new normal and how we operate and how we do things.
I hope you get a bit of rest now, you and your district health unit team. It's been a crazy couple of months for you.
It certainly has, and I think we are shifting into a more sustainable pattern, I think, but it is challenging, and there's certainly a lot of work to do.
Thank you so much for joining us this morning again.
Thank you very much.
Take care. Lisa. Bye-bye. Dr. Janet DeMille, the Medical Officer of Health for Thunder Bay District Health Unit.